In this video, I am going to go over some of the most common EMT terms to help you prepare for EMT class or just give you a better understanding of these terms. BSI stands for Body Substance Isolation or Personal Protective Equipment. This most commonly includes gloves and eye protection. This is one of the most important things to remember because this is going to keep you safe and allow you to perform your job. MOI stands for Mechanism of Injury. This is going to be more along the lines of a trauma incident, as far as a car accident, a fall, gunshot, or stabbing. NOI stands for Nature of Illness. This is more of a medical incident, as far as cardiac, a respiratory incident, or allergic reaction. C-spine stands for cervical spine precautions. You might want to ask the patient if they fell, if they hurt their neck, hit their head, was there any trauma involved. We now have to figure out their LOC, or level of consciousness. We figure out their LOC by using the OPPPSRT Scale. OPPPSRT stands for alert. They are going to be alert oriented. Verbal, they respond to the sound of your voice. Pain or painful, they respond to painful stimulus. Or they're going to be unconscious or unresponsive, where there is no response. Sample and OPPSRT are two terms that we use in medical and trauma scenarios. S stands for signs and symptoms. A sign is how you see the patient, and a symptom is what they are telling you. An example might be, the patient looks like they're having difficulty breathing. That's a sign. A symptom would be they are telling you that they are having difficulty breathing. So the patient is complaining of chest pain. I use the OPPSRT scale to verify the signs and symptoms. So the OPPSRT scale is kind of part of the S in the sample history. So when did the pain start? What makes the pain better or worse? Can you describe it to me? Let the patient describe what they are feeling. Does it hurt anywhere else besides your chest? On a scale of 1 to 10, 10 being the worst pain you've ever felt, what is your pain? And how long has the pain been going on? Was there any trauma involved? And if you did anything to treat the pain? Now we can go back and finish the sample history. Ask the patient, do they have any allergies? How bad are your allergies? Do you have any allergies to medications? Are you taking any medications? Do you have any past pertinent history? Have you had chest pain before? What was the last thing you had to eat or drink? And what were the events leading up to this incident? What were you doing prior to having chest pain? Were you jogging, mowing the lawn, walking up the hill? So now we're going to talk about trauma scenario. DCAP-BTLS is an acronym we use for trauma scenarios. The D stands for deformities. Example would be broken bones or dislocations. C stands for contusions, bruising, discoloration. A is abrasions. A scrape or road rash would be an example. P stands for punctures. That would be a stabbing or penetrating wound. The B stands for burns. How much of the body surface area is covered by the burn? How bad are the burns? To what degree are the burns? T stands for tenderness. Is there any pain upon palpation? As you're touching the patient, do they have any pain in that area? L stands for lacerations, a deep cut or tear in the skin. S stands for swelling. Feel and look for abnormal swelling. DCAP-BTLS are terms that we use when we're doing our secondary trauma assessment to uncover hidden injuries that the patient may have. I hope this video was helpful. If you enjoyed this video, please like and subscribe to the channel, and stay tuned for shoe restoration videos and also more EMT prep videos. Thanks for watching.